In any other news cycle, this might be our top story. President Biden has tested positive for COVID. The positive test came on Thursday as part of a routine screening. The 79-year-old president, who is fully vaccinated and twice boosted, completed his first day of the antiviral Paxlovid on Friday, and he is already seeing his symptoms improve, according to the White House. In a video released across the president's social media accounts, Biden said he will continue to work while in isolation. According to the CDC's guidelines, that means he will be working over the phone and on video conference until at least Tuesday. The president's positive test did not catch the White House off guard, though, because it's reportedly something that they had been preparing for since he took office. And it's not a total surprise considering the transmissibility of the new strain of the virus. Experts considering it the most contagious yet. This Omicron subvariant now estimated to make up more than 60% of the new cases. And this has caused hospitalizations to more than double since late April. The president being infected as the virus surges for a third summer is a stark reminder the pandemic is far from over. And the administration's plans to use the president's positive test result as an example of what all Americans are still facing, underscoring the importance of getting fully vaccinated and boosted.
It's a reminder of the reason that we all work so hard to make sure that every American has the same level of protection that the president has, that every American has the same level of immunity, and why we have worked so hard to make sure that people have access to life-saving treatments like Paxlovid. These are incredibly important things for the president to have. They're incredibly important things for every American.
Still, questions remain about whether the administration is doing enough to control this new wave. And health experts are left wondering if they missed an opportunity to refocus the public's attention on COVID ahead of this latest surge. One of the health experts that has never stopped raising the alarm is Dr. Ebony Hilton. She's an MSNBC medical contributor, and she joins me now. Dr. Hilton, it is always a pleasure to have you here. Listen, since we've already kind of now gotten to the point where we're hearing voices on the far right saying that Biden's positive test steps on his administration's vaccine message. How do you respond to people that are saying that this just proves the vaccines aren't working?
Well, the analogy I give them is if you put on a raincoat and you jump into a swimming pool, you will get wet. Vaccines do not make your body impermeable to COVID-19. What vaccines do is literally give you a blueprint as far as your immune system to say, if you get in contact with COVID-19, we already have the tools in place. Your antibodies, your B cells, your T cells are already within your system so they can begin to attack the virus on day one, to prevent it from being able to replicate and get into overwhelming counts within your body to cause that inflammatory response, if that makes sense. So it's not that all of a sudden you are immune from COVID being able to be breathed into your face and into your airways if someone coughs in your direction just because you're vaccinated. That's not the point of the vaccine. It is to make you more safe, and that if you are infected, that your body can respond in a timely fashion, because 1, 2, 3 days, the difference in that time lapse literally can cost you your life.
So, Dr. Hilton, what does the Biden administration have to get right in order to turn the president's positive status into maybe a teachable moment for Americans?
Right. I think messaging is key. And I think also what the administration has to get right is that, yes, we have tools in our toolkit to help and treat you after you get infected. What we have to get right is we want to start preventing infections in the first place. And what do we do to do that? We do the same things we were doing back in March of 2020, before we had therapeutics, before we had vaccines. We go back to those basic principles of masking, of avoiding those large crowds, not shut down necessarily, but to be smart about it. Because at this point, within the last 2 weeks, we have an increase of our cases of at least 19%. And I say at least 19 because we know people are testing at home now more than they're going into the hospitals and the clinics. We know we have an increase in hospitalization of 18% in the last 2 weeks. And unfortunately, an increase in our deaths by 34%. We are not out of this pandemic. We are losing 400, 500 Americans a day when we do not have to go down that route. So the same way we saw the Delta rise back in July of 2021, in the same way we saw the original COVID rise in July of 2020, we're seeing that now with BA4 and BA5 in 2022. COVID has not changed. The only thing that has changed is behavior of people.
You know, Dr. Hilton, those numbers are startling that you're saying. Public complacency over the coronavirus and its politicization, by the way, has led to this concept of COVID fatigue. You had an interesting tweet last week about long COVID and how we just don't even know the full effects of long COVID yet. What is your message to anyone who thinks catching COVID is still, quote, no big deal?
Right. You know, it's one of these things I've said from the very beginning. We became obsessed with the death count. We kept saying, oh, this many people died, of which that is very important. But there are some consequences that can be more painful than death for some persons. And that includes not being able to breathe adequately, right? To go into heart failure. And we know historically, there are viruses that have shown us that they can cause long-term impact on the way your body functions. And we can talk about the hepatitis viruses that were rampant in the 60s and 70s, leading to people having liver cancer and needing liver transplants. We can talk about HPV. Women, we get screened for this with our pap smears to make sure that we don't develop cervical cancer. But men, you also are in the game in that it can cause esophageal cancer, for instance. We know that EBV, Epstein-Barr virus, can lead to multiple sclerosis. Those are the long-term consequences of infection. And the question I have is, when people are losing 2 of their 5 senses, when they say they can no longer taste and smell, what does that mean for the long-term consequence of what that does to your brain, of all things, right? And we don't know that at this point. But what we do know is that there are persons that for years have now been without those senses. We know there's persons that for years now have been with chronic fatigue, with pain to their limbs, their body aches. We know they have now new heart issues as far as arrhythmias, AFib, A-flutter. We know these things exist. And the question is, what does that do to the longevity of life and to the quality of life? And particularly what I really think about is for children, because how does a 2 or 3 or 4-year-old tell you that they can no longer taste and smell? That is not a mild symptom. And I oftentimes wonder, if you lost your hearing and your sight, if you are deaf and blind related to COVID, will we still call that mild? Because they are senses too.
You know, Ebony, we normally don't look at doctors as advocates, but I'm really proud to know you because since day one, you have made sure that America knows the facts. And that's really critical when there is this politics now that's being associated with such a ravaging pandemic. Dr. Ebony Jade Hilton, thank you so much for taking the time to talk to us about the fact that we are not out of the woods yet. I appreciate it.
Thank you, Katie.